As I always say, health doesn't occur in the doctor's office and the hospitals alone. It occurs where we live, where we learn, where we work, where we play, where we pray. Health is in everything that we do. Basic food, it's hard to think about, what do I eat when I don't know where my next meal is coming from.
So food insecurity encompasses a lot of different issues. One is access to healthy food versus not healthy food. One is access to food at all. There are many, many people in this country that go hungry every day.
If you think about food insecurity, access to fruit and vegetables, access to healthier foods, access to the things that will give you a chance to be healthier. If you think about investing in food insecurity, if you think about advocacy to ensure that young people around the world get access to healthier food, all those things are critically important. The recipients of AHA funding are changing their communities because they're meeting the needs of the communities when others are not. And our recipients of funding are those people. They know the communities, they know the people, they know the issues.
Bringing farm fresh produce to schools so that parents and families at these Title I public schools have more convenient, cheaper access to healthy food choices.
Our mission is to increase food access, make it affordable to residents. We use our network of corner store owners to improve health to residents that shop at stores. In our model, because we are shifting that stock on the shelf, it is shifting the relationship between store owners and community members.
Certain areas, you have people who have high rate of cancer, a high rate of diabetes, a high rate of hypertension, and you look around the area and you realize it's because they don't have a supermarket and because they don't have access to fresh fruit and vegetables.
Eat right, it's expensive to do it. Even if you go to the store and try to buy, fruits there, once you go to that scale, you're like scaled out. You can't afford it.
We know what we can include, and we know the things they need more of. And with us, they're able to taste all these things. They're able to pass on this to their kids, and their kids are saying, I prefer to have this now instead of the junk food.
So we've seen these organizations that we've invested in, they knew what they wanted to start up and to do, what their needs in their community, and oftentimes they just needed a little boost, a little something to start them.
Bigger thing is not only do they have a great idea, but we want them to be sustainable. We want them to be successful. We want it to be scalable. Because if they're scalable, they can go get other investors. They can exponentially increase the number of people in their communities that they're helping, and therefore the health impact that the AHA is interested in can exponentially grow. The best way to think about how we also add value to our financial recipients is the partnership. I would say it's a partnership. We not only provide funding to our investees, but we really do see ourselves as helping think about capacity, really think about problem solving.
The American Heart Association Social Impact Fund has given us this really rare privilege as an organization to feel secure about and to plan for the longer term.
So it's not only we're able to continue our operations, but helping us establish tools that allows us to scale our work.
The AHA are thinking about the whole person and everything that would go into one being able to live a longer, healthier life.
In a fund like this, you're measuring impact first, focusing on impact first, but looking to create sustainable investments that will provide some return, so it's a sustainable source of capital to support other companies along the way.
Is that you too can drive significant change in communities addressing the social drivers of health, which play a significant part in someone's ability to live a longer, healthier life.